For any of you who don't know ProMED, I really would suggest that you get to know it. So ProMED Mail is one of the programs, a surveillance program of the International Society of Infectious Diseases, and it's daily sends out posts through social media, email, etc., about what's going on in the world in terms of infectious diseases, really across One Health sphere, actually. And so we last met, I think, on the 3rd of December. And so I've just gone through from the 3rd of December. I actually almost didn't get into January, so much happens. But I thought it'd be interesting, and there's a few things that I think are interesting and bear repeating from ProMED. Okay, so the first thing to happen was an outbreak of institutional Legionella, and under the picture is a reminder that we too at RHODE, and probably in most of the hospitals, for others sitting in outside hospitals, also have problems with Legionella in their water systems. And so going forward now into 2022, just need to remember that patients who do develop pneumonias around the E12 and that sort of complex of wards around there, we need to think about hospital-acquired pneumonia with Legionella. But this outbreak occurred in the US. It's obviously Legionella. It really is very much related to not only institutional water systems, but plumbing systems as well. There's an optimal growth range for Legionella, and when one's designing water systems and thinking about how you might try and eradicate Legionella from water systems, you need to think about keeping those systems outside of the optimal growth range, which is 25 to 40 degrees. There have been cases of person-to-person transmission, and also interestingly, I didn't realize that it can occur from contaminated wounds. And it's a real bugger to try and get rid of, largely because Legionella can hide within protozoa and multiple protozoa in water and water systems, which affords them protection. And also they're very capable of very long-term persistence in biofilms in a state which is non-culturable. It's called VNCS, viable but non-culturable state. That sometimes occurs. They go into that state after you've tried to get rid of them. So how can you control? Well, when designing, we try and avoid dead ends and stagnation. One of the problems with E12 is that in that water system, there were these huge tanks, dead end tanks, which had to be emptied and cleaned out. Environmental surveillance is part of hospital surveillance for infection prevention and control. Unfortunately, it doesn't always happen. And then you've got to try and heat the water to over 50 degrees. Again, a problem in our water system at RHODE because you can't maintain that water at such a high temperature. And obviously, the higher the flow of water rate, the less likely you are to get deposits of Legionella sitting around. And then there's a variety of disinfectants, mainly based on chlorine or chlorine-related products. And then there is some data for good old copper, silver, UV light, but I mean, how you get UV light into water systems is difficult, and then ozone therapy as well. So this isn't just about people going to hotels and other things, very much hospital-acquired infections and institutional infections. I'm sure there have been outbreaks in Polesmore, just one to keep an eye on, particularly for those at RHODE, remembering the issues around E12. And I've listed some, on each of these slides, listed some further reading if any of people want to do it. And this will also be posted on our GSHID YouTube channel, so you can have that. Okay, on the same day, in a different area of the world, in our area of the world, they were undergoing an outbreak of hepatitis E. Now, the outbreak in Chad, and remember hepatitis E, it's usually fecal oral, There are 20 million cases per annum, so it's no small problem. And it is really related very much to poor water and sanitation, WASH. So in other words, lack of access to clean water and safe sanitation, which of course in South Africa and on the African continent is very much an issue. And like leptospirosis, I guess, recent floods, recent flooding is a risk factor as well. And this isn't the first outbreak that's been in Chad. They've had recent ones as well in the last 5 years. But it can also be fecal oral through, particularly there was an outbreak in France with this rather exotic sausage called figatello. I don't eat figatello myself, but there was a large French outbreak reported, I think, in New England Journal of this issue. And just also to remember that this is also a very severe infection in pregnant women. So it has greater severity in pregnancy. And there was a recent ProMED posting of outbreak in Sudan in pregnant women with multiple fatalities. So interestingly, hepatitis E, again, for my learning, was that different genotypes are associated with different epidemiology. So community outbreaks, generally genotype 1, which can also cause acute epidemics, as with genotype 2. But then genotype 3 is really very much more limited in high-income countries to zoonotic infections, where you just pass directly from animal to human, and they don't really cause outbreaks. But really, bottom line is in Africa and low-income countries where there's poor access to clean water and safe sanitation, including South Africa, this is an increasing problem. And if you are going to France, perhaps stay away from raw figatello. Quite why anybody would want to eat raw sausage like that, I'm not sure, but each their own. Okay, the next day, still in Africa, although this picture is taken from Bangladesh of cholera beds, rather unpleasant, but you basically arrange the patient's lower regions around the hole, because as you know, there's massive fluid loss in cholera. And Cameroon and Nigeria were experiencing the latest cholera outbreak with a really quite high case fatality ratio. Usually it's less than 3%. This was quite high, and we now take oral rehydration solution for granted, but back in the 1800s, it was really intravenous fluid becoming standard. It was only relatively recently, in the last 60 years, that oral rehydration therapy was realized to be beneficial, because it was proven that there isn't actually destruction of the intestinal mucosa, so they can absorb. And that really showed very early on in 1973, in one of the first reports in a big outbreak in Bangladesh, such a reduction, tenfold reduction in mortality, just with these glucose salt packs. I just highlight in red just the really impressive amounts of, just to remind ourselves, the really impressive amounts of fluid they lose. And you need big amounts of fluid, particularly in initial resuscitation, be it intravenous or oral. And so we haven't had a cholera outbreak in South Africa for a while. We have in Zimbabwe and neighboring countries. So we would do well to keep a few plastic sheets with holes in them available. Okay. Ukraine's had a really rough ride, as you know, in the past few weeks, with Putin trying to reinstate his power there. And unfortunately, they've also been hit by an outbreak of botulism. And I just list here again from ProMED the listings of different outbreaks of botulism. And I always, when I think of botulism, I always think of canned mushrooms. Of course, any canning process, can allow the spores to maintain and then cause disease and infection. But as you can see, interestingly, in the Ukraine and in Eastern Europe, there's a lot of outbreaks that relate to smoked fish and other smoked products like goose. And And also in Canada, my favorite, I guess, is from 2016 in fermented seal. So if you are eyeing up at Colt Bay, the old seals on the beach, or any of the seals around Cape Point for something for your braai, perhaps that would be okay, but try not to ferment the seal and eat it because botulism is possible. So there were 4 people in the same dinner at Ukraine who got this. And sadly, not only because of, obviously the destruction that Russia is trying to reap on the Ukraine, but resource limited setting, there was only enough antibotulinum serum for one of the patients. The other 2 had to get it from 2 of the others who ended up in ICU. Families had to try and find it on the black market. And as I said, quite a large number of cases actually are due to dry or salted fish. So it has been transmissions directly from soil in kids who sort of eat soil pica or just playing around. And then, as you know, you can also get it from intravenous drug use. Okay. So now a virus that probably the virologists might have heard of, but I certainly hadn't. On the 8th of December, there was the first human case in Rhode Island of a viral illness caused by the Jamestown Canyon virus. Jamestown Canyon is, as you can see here, is a beautiful canyon in Colorado, Rocky Mountains. It houses Aedes family mosquitoes, particularly this mosquito Culicita inornate. And that was the Jamestown Canyon virus was first described in the 60s. It's an orthobunya virus, much more commonly distributed in eastern and midwestern US, but apparently not been seen in Rhode Island as of yet. And the female mosquitoes hatch ready to go because it's transovarial transmission with amplified hosts in deer populations. And it's an encephalitic illness. You can see here the brain imaging, and it has caused congenital defects. So everybody in the States really focuses mainly on West Nile virus, and we think about West Nile virus. But there are a fair slew of viruses, interesting viruses, depending again on where you go, and emphasizing the importance of a travel history, which is important. So that was occurring while we were also away from each other. Unfortunately, as you know, war-torn regions are a springboard for many recurrences and reemergence of infectious diseases, and the appalling carnage going on in Yemen with the war there is taking its toll. Wild type polio obviously is really diminishing greatly. Vaccine type is understood to occur predominantly to the polio wild type virus 1, or polio vaccine, strain 1. Circulating vaccine-derived polioviruses are annotated as CVDPV, and there were 2 cases of poliomyelitis in Yemen. And the important thing about these are they were over 400 kilometers apart, and that says that this virus strain is now circulating in Yemen, which is very bad news for polio eradication. And there's been an ongoing outbreak of actually serotype 1 in Yemen as well, which has paralyzed, as you can see, a large number of children. And really, it's this issue of this crucible of problems in a war-torn country, very, very much low resource, which has also been ravaged with COVID. And one of the problems is that because of all of this, there's a very large-scale migration now occurring from Yemen into the Horn of Africa, which again causes real concerns around the spread of this into neighboring areas. And really the solution is IPV rather than oral intravenous vaccine, which they require 2 to 3 doses. The person who was writing this for ProMED was putting forward the case for potential respiratory transmission, which is, is generally fecal oral, as you know, but the majority of the cases, almost all cases, are under 5. And for oral transmission, you might not expect that. So there is this question of respiratory transmission. But I think, again, the sadness of war-torn countries is that this sort of thing re-emerges, and that's what's happening. Okay, influenza, always in the backs of our mind. We've been dealing with COVID, but don't forget influenza. In Canada, there have been a number of cases of this H1N2 variant. Now, normally H1N2 is one of the strains that circulates really only in swine herds, but very rarely is transmitted from swine as a zoonosis into humans, and it's then annotated as H1N2V or variant. This is only the 3rd case in Canada. I just redraw your attention to the issue of pandemic influenza, because although there can be a jump from animal directly to humans and then human transmission, as occurred in Spanish flu in 1918, what is increasingly happens, like the 57 and 68 outbreaks, and then again swine flu in 2009-10, was that you get reassortment of viruses often within swine. So you have an 8 segment genome in influenza, and if you get 2 or 3 different viruses in the same cell, then there can be reassortment, and the new virus takes on different parts of the genetic sequence, different segments, and that's how you get an entirely new variant, a new influenza that has not been seen by the population before, which has no immunity. And it's just good to rehearse again the different phases of a pandemic phase, 6 phases. Initially in phase 1, as humans, we're not so worried about it because it's just circulating within the animal. In phase 2, there is this single case, or maybe 1 or 2 cases of transmission from the animal to humans, like in this case. Then it starts occurring more transmission from the animal to humans, and then it starts increasing in terms of community spread within population in a single country. Once it gets into different countries with community transmission, we're at phase 5, sorry, I do apologize about that. I seem to be being called. Can you now? Yep. So in phase 5, the pandemic is imminent, and we say that a pandemic is underway fully when there is community transmission in more than 1 country, in more than 3, I think it is, WHO regions, and that, of course, is what happened during the 2009, and of course what's happening in COVID-19. So influenza is ever present and should be never too far from our minds. Onchocerciasis is usually very far from our minds, but Niger is moving towards being the first country in Africa to eliminate onchocerciasis. Really an incredible feat. And for Tarry, who's going into his exam soon, you'll remember this life cycle, which involves the black fly simulan, which is a small, quite an unattractive fly, which carries the infectious larvae, which then are transmitted into the host. And remember, onchocerciasis is not only the cause of blindness, it affects the eye, it's a cause of some really extraordinary skin manifestations, including what you see here on this graphic, which is called leopard skin. But you also get a variety of different skin manifestations, like I think it's the Ethiopian word for black, which is a Sauda, S-O-W-D-A. You get completely blackened limbs. And the characteristic, Tarry, as you know, of of onchocerciasis skin lesions is their incredible itchiness, pruritic. Now, I'm surprised that Niger have almost got there, of course, because the predominant treatment is ivermectin, and as we know, the world has been drained by ivermectin use by COVID, the COVID crowd. But because of that, I was interested in looking at different drugs, and I learnt about a drug called moxidectin, which is a macrolide-like antibiotic, actually, which had benefit over and above ivermectin. What you're looking for, the reason it had long-term over and above effects is because it had a much longer effect on the microfilariae in the skin. It doesn't affect macrofilariae, but it does produce microfilariae, and it doesn't cause any greater side effects, which the most concerning side effect is the Mazzotti reaction, which is, can cause very severe fever, encephalopathy, etc. So well done, Niger, even in the face of the world's stock of ivermectin being taken away. But moxidectin is really the new drug on the market now for big, wide-scale eradication programs. So that's one type of blindness. And for Lucas, of course, I thought we should mention the fact that there has also been a blind eye being turned elsewhere, including in Abu Dhabi. And few of you will know that Sipo and I had a number of bets with Lucas, as he's Dutch and a great Max Verstappen fan, as to the outcome. And we feel that we've been cheated because we were offered various amounts of food and I think even a car at one point and a weekend away, I think, together. Anyway, so Lucas, if you could put your microphone on, if you can answer more than 3 of these questions, I will buy you breakfast and honor some of my other commitments, and Sipo will buy you a car. So Lucas?
1 million.
Spelt with 1 L or 2 L's? Have you got Wikipedia in front of you?
1 L. No, Prof, I would never. I would never.
What's his date of birth?
30 September 1997.
Come on, you've got it in front of you. Okay.
And born in Brussels.
Yes. And what's his mother's maiden name?
Oh gosh, I have no idea. And I can't scroll that quickly, Prof.
Okay. Well, thank you. So, okay, can you talk to Sipo about your car order, and I'll bring in a croissant for you. So thanks very much. Thanks for playing. Okay. Moving on, Lyme disease. Always being asked, is there Lyme disease in South Africa? The answer, we think, is no. But in the United States, it seems to be expanding its geographic profile. We generally think about Lyme in the New England states, New Hampshire, Vermont, Rhode Island, an epicenter, and on the other coast. But actually, these Ixodes ticks are moving towards Central America, Central North America, Central United States, and Nebraska is now on the list. And just to remind again, Tari, your benefit, erythema chronicum migrans starts as a small sort of papule, macular papule, and then expands outwards, which is shown. And sometimes it's atypical. This lady had multiple. It causes carditis, and you'll be able to see the prolonged PR interval and loss of QRS complexes, arthritis, and sadly, and hopefully this young girl improved, but a nerve palsy with cerebral cerebrovascular and central nervous system Lyme disease. Okay, and treatment for most of them being doxycycline and for neuroborreliosis, ceftriaxone. John Frean wrote a very nice commentary, which I've referenced here, around scientific basis for treating what a couple of doctors in Johannesburg call Lyme chronic fatigue. with 3 years or more of doxycycline. And basically, of course, there's no evidence for that. Okay, just when you thought coronaviruses were dead and buried, we remember that MERS coronavirus is still going. So on the 15th of December, more cases from Saudi Arabia. This was a 60-year-old camel farmer, actually, yeah, a 60-year-old camel farmer who presented during the COVID pandemic. His SARS-CoV-2 PCR was negative, but his MERS-CoV PCR was positive. And so I think it's also quite interesting, of course, because we've had this real innovation around vaccination for coronaviruses with the vector vaccines and the mRNA vaccines, that actually is a lot of work going on. And there is now just this year, a very recent publication on the first phase 1 trials with the ChAdOx MERS vaccine as opposed to the SARS-CoV-2 vaccine, which seems to have fairly nice durability in the upper panels, which are the antibody responses from baseline with some dose dependency, and also the T cell responses, which are shown in the bottom panels. But of course, you're certainly going to require boosting. And then there is also work going on mRNA vaccines against MERS-CoV, and I think we're going to see a lot more of this for other infectious diseases. Guinea worm, we're almost there. It's going to be the second infectious diseases to be eradicated after smallpox. And there has been this sort of ongoing outbreak in Chad. Chad actually has 2 really major neglected tropical diseases. One is guinea worm, the other is yaws, both of which are subject to huge eradication programs. And you can see the adult female worm being carefully removed. Often in each of the villages where this is endemic, there is a specialist villager who can do this, because if you do it too quickly and it snaps, you get sort of anaphylactic response. But the dracunculus is transmitted as larvae in copepods, which are small crustaceans. They're eaten, and as the crustaceans dissolve in our stomach, the larvae are then released and burrow through into the abdomen and the retroperitoneum. They then mature, and the female and male worms bump uglies, and then the male dies, and the female migrates through subcutaneous channels through to the limbs. And after about a year, the female, after infection, the female then burrows through makes a blister and burrows through. And then as she contacts water to try and soothe the itching and pain, she releases eggs, and it all goes on again. And really the idea was that this was really the predominant routes of transmission, but there is this now route of transmission through fish. And it's not clear whether we can get it through eating fish, but the dogs eat raw fish in the village, which have these larvae in, and it goes through the dog, and then the dog, and then the cycle can go through the dog into humans. And really, the majority of infections now are actually in dogs in Chad. So if you're off to Chad on a dog holiday, anybody who's particularly interested in dogs, some big, some small, be careful not to get dracunculus. Okay. Shigellosis. This is Dr. Shiga, who described the bacterium. We know it's the cause of dysentery, bacillary dysentery, the commonest cause of bacillary dysentery. And again, neighboring Zimbabwe, there was an outbreak in Bulawayo, in one of the communities there, over 100 residents coming down with shigellosis over Christmas. Very low dose of infection because it's very hardy against acid, so it can get through into the small intestine, it replicates, and then a large burden of bacteria get into the colon and do their thing. And this, again, for TARI and for registrars, this is a very nice review paper by Mattock and Blocker from a few years ago, about how the virulence factors play together to actually cause the pathology. And there are various, as you see, the various different the virulence factors. The Shiga toxin, as we know, is most commonly in the E. coli, but actually Shiga toxin also is produced in Shigella dysentery. So I would point you towards this interesting review, but also to remind you that Zimbabwe is not very far away, and Shigella travels, as do all pathogens. Our good friend Candida auris is increasing its move across the United States. First time, I think, in Oregon now. There have been over 1,000 cases recognized in the United States. Again, a really, really professional and clever fungus or clever pathogen able to resist in the environment very, very well with biofilms and tolerance to heat, tolerance to osmotic pressures, stress and resistance. This is really one of the great resistant pathogens, and clearly is going to become increasingly problematic. Treatment is difficult. 90% were resistant to fluconazole, as you can see, and so echinocandins is sort of your best bet at the moment. And there aren't really well-defined and accepted resistance, MICs for the different antifungals, but these are the breakpoints suggested by for Candida auris by the CDC, pending good breakpoints. Maybe our microbiology colleagues will be able to put me right there, but from my reading, that was the event. One of my really favorite tropical diseases is American trypanosomiasis. There's been a recent outbreak in the Colombian army. Now, as you know, this beautiful bug, the reduvid bug, Triatoma infestans, is the James Bond of the bug world. It loves to put itself in the cracks in these mud huts in the Amazonian rainforest usually, and at night it then leaps out of these cracks and parachutes down onto the skin, where it defecates and rubs its back legs to excoriate the skin, allowing the entry of the Trypanosoma cruzi, which you can see in the lower left panel, into the skin, and that then starts to migrate, and in the initial stages can cause Romano sign, which is what you see down on the right, which is this swelling, periorbital swelling. So these reduvid bugs are just quite magnificent. It's always said, if you do go and visit and stay in one of these huts, don't sleep on the floor. I guess they overshoot the bed and on the floor and can't get up. But interestingly, they've also been, and they think this is the case in outbreaks, because it's usually individual cases, but in outbreaks, it's been associated with fruit juices, because the bugs get around fruit and they get crushed in your fruit juice during preparation, and then the trypanosomes get released. So there's been outbreaks in Brazil and Venezuela from sugarcane juice and guava juice. So when you're next in the Amazon, don't just be careful of your bedding, be careful of your juices. A rare occurrence, China, we've all been focusing on COVID and influenza from China, but an interesting case, rare case of amoebic meningoencephalitis caused not by Naegleria, but Naegleria, anyway, but by Balamuthia, which was fatal in a 15-year-old boy. And just to remind you that doesn't just cause meningoencephalitis, it also causes skin disease. You can see some of the more horrific manifestations. The top one's quite interesting, because I would have thought Balamuthia was really very aggressive, like in the bottom, and but maybe it's somebody who did actually survive, although the mortality rate's 95%. And you can see the life cycle here. So it's mainly in warm climates. And management is really hectic. I mean, there's no really good regimen, so it's basically throwing everything at it with albendazole, miltefosine, which is highly, as you know, highly got a very high side effect profile, very toxic. People do add in an azole, and then if you've got pentamidine, some add in cotrimoxazole as well. So it's really polypharmacy for this very difficult and commonly fatal infection. So now we're in January and we're close to the end, because I couldn't get all the way through January. If you're planning a sex vacation in Ireland, be careful. Syphilis is rearing its head, as it were, and there have been an increase in the number of cases in 2021 from the 600 before to 792. So a larger increase. It's predominantly in MSM, but there are increasingly cases outside of the MSM population. If you want to know where the hottest spots are, not hottest ulcers, well, both actually, the hottest ulcers too. Off you go to Dublin, Kildare and Wicklow, but County Cork is also involved. And interestingly, again, the COVID situation seems to have played a role. Initially, there was a reduction in 2020, sorry, because of the probably lack of access to healthcare. Sorry, there was an initial decline seen in 2020, probably in the previous year. There wasn't a lockdown then, there was. And then in 2021, that's seemingly linked to a reduction in access to care. Lastly, and sadly, that's not good. Lastly and sadly, this report on the 12th of January from the United Kingdom, where malaria in Humboldt penguins decimated almost all of the Dudley Zoo colony. And interesting, avian malaria is usually, fairly subclinical, but in these captive colonies, which I guess we're not captive, but it is a colony, and in our boulders area, I don't think penguin avian malaria is a problem in boulders, but this was a chilling reminder that penguins is not only the humans, and it's also very much linked, avian malaria and human malaria, of course, as you know, to climate change. And there's been modelling recently in the UK suggesting that Vivax and even potentially falciparum could be already occurring. Now, 150 years ago, East Anglia, where Cambridge is, where I used to live, was a hotbed of malaria. And it'd be interesting to see if we see it again. Okay, so I thought as the final part of the talk, I would ask Sean to help us with an online Wordle. So the other thing that really happened while we were away was this thing absolutely took off. And anyone who doesn't know Wordle, it's very addictive. It's online, and basically you have to make a 5-letter word, which can have repeated letters. And you have 6 goes. And if anybody's played the game Mastermind with coloured pegs, where you 2 players, 1 player puts different combinations of coloured pegs into 6 slots, that's covered from view, and then you have lots of pegs, and then you have 10 goes to find out the word. So, Professor Wasserman, we have heard how very, very good you are at this. So I would like to invite you, I will type it in for you. What are you going to do?
Well, firstly, that was a really cool talk. Thank you very much. Pleasure. And the main thing that I wanted to comment on was your use of widescreen slides. The first time ever I've seen that.
Got to keep up with the Wassermans.
Yes. But you've maintained your aesthetic. It was really beautiful.
Thank you.
Okay, so my strategy for this is to select the first word that contains as many vowels as possible, right? And then also a couple of commonly used consonants. So the one that I always use, I kind of alternate between 2. One is the word raise, and the other one is the word ideas. So let's go with raise for the first word. And another good one to start with is outer, which I sometimes use.
Okay, could you tell people who don't know it what this means now?
So the letters shaded in gray mean that the actual true word does not contain those letters, and the letters shaded in that kind of browny, mustardy color means that the word does contain those two letters, but not in those positions. So we know that the 5-letter word that is the word of the day has an R and an E somewhere in it. So now we have to try and get this in 2 goes. I know that Mark's strategy is to just use a standard second word, so that he never has a chance of getting it in 2 goes. So what would you do now?
Well, I might go with outer, because the E and the R, I don't know. Yeah, go for it. Well, what would you go for?
But I mean, I wouldn't. So my strategy would be to include the R and the E, so I give myself a good chance. So I just need to think about this.
So outer does do that.
Yeah, let's try that.
Okay.
Oh.
Okay. So the green means that the E and the R are in the right place. So this word has U, E, and R in it.
And we have to get this now in 3, because I mean, we just need to guess 2 other letters. Under, Lucas.
Lucas thinks under. Okay, let's go for it. Looking good. Oh no, Lucas.
Person in the chat got it right.
Sipo, you don't have to.
We got an ulcer.
It's ulcer.
No, but you're not meant to tell